Welcome to our Clubfoot webinar all about skincare. If you're a Clubfoot parent, you know that one of the biggest challenges that we face on our Clubfoot child's treatment journey is caring for our child's skin. Everything from what socks they should be put in to what is athlete's foot is on the table. So, we're going to discuss it all today with our incredible guest, Shannon O'Shea. Shannon is an ABC certified prosthetist orthotist at Hanger Clinics and based in Kansas City. She sees patients at the Children's Mercy Hospital and Ability KC locations. She is a strong believer in education and is passionate about ensuring families feel comfortable with and supported through their child's care journey. And that's exactly why I asked her to be here with us today. So, Shannon's going to give just a brief intro about what she tells parents for basic skincare when they start their boots and bar. And then we'll dive into the Q&A that we source directly from the parents. So, thank you for being here, Shannon.
Thank you very much, Maureen. I am honored to be asked to discuss skincare.
It's such a big deal. I think it's one of those things that we get a lot of questions about just because the child's foot is in the device for such a long period of time. And skincare management is one of the main topics that you see in all the parent groups. And it's a topic that I've wanted to talk about kind of more exclusively, not just in relation to all of the other parts of treatment. So I'm really excited that you are willing to be here and to talk to us about it today.
Well, again, really appreciate it and super excited. So, skincare is one of those continual topics during clubfoot treatment, as you just mentioned. As soon as those boots are right on your baby's foot, it's under a microscope at that point where you're constantly hyper focused on the fit of the device and also the care of your child's skin. So it really doesn't matter if you are picking up your first set of AFOs or if it's your last set of AFOs. It's important that skin maintenance is discussed in each appointment. The goal initially is your cuties clubfoot boot and bars need to be worn for 23 hours a day until your orthopedic treatment team advises to reduce to nights and naps, and then of course nights only, which is like every parent's like best thing is like it's just at night at this point. And this will optimize, of course, your child's clubfoot outcomes, but the underlying skin correcting the musculoskeletal alignment needs support. And that's going to be your eyes as the parent. You're advocating for the skin in your child. So the skin eventually will definitely become accustomed to the orthotic device, but it's important to be mindful initially of what good skin redness is versus what bad skin redness is. And that's each time you're removing your cuties boots is assessing that skin along the way. So what I'm typically telling families is differentiating between the two, what is good redness and what is bad redness. So what I describe good redness as is a redness that dissipates or fades within 30 minutes of the removal of the boots and the socks. Of course, you can't see the skin when the sock's still on, so making sure you're taking off the sock as well. When you see good redness following the removal of the boots, where you see it is in specific spots for clubfoot management. So I have my lovely assistant here with me, and I'm just going to kind of show you where ideally we would want to see those socks. Pardon her hairdo. It's just a little bit crazy. But where we should see that redness on your clubfoot cutie's foot would be along the big toe, on the top of the dorsum of the foot, so kind of where the tongue of a shoe would land, and then the back side of the heel. Those three areas of contact redness is an area where we are actually protecting the foot's alignment and collectively trying to achieve the goals of correcting the clubfoot. So those areas you should really see some good redness of contact each time you're removing the boots and bars. So that's something, again, good redness should occur because that means that we are actually correcting the alignment of the foot. if you were to be able to take off the cast during your casting side of your clubfoot journey, you'd also see redness underneath the cast because, again, the goal is achieving the skeletal and musculoskeletal correction. But what I then kind of try to tell families is what bad redness is. So bad redness is actually persistent redness that does not fade within that 30-minute time frame of the removal of the device, or it creates a texture change of the skin. So the goal of this webinar is to kind of further discuss ways to prevent bad redness and answer, those common questions that do come up, as you mentioned, like what athlete's foot is.
Yeah, I think that's such a great overview, that good redness versus bad redness, because I think as parents, we start to go, any sort of redness looks like an indicator that something is a problem, right? Like you think about that in your own skin. You think, oh, like I have like some red marks here. Is that a rash? Is that going to be something bigger? And so there's this constant trying to decipher what is good versus bad and trying to determine, okay. And I really like that about just the alignment of the foot and knowing like some redness is to be expected because that is showing that the device is working. It's then trying to determine what leads to that bad redness and things that are concerning, that I think where parents really get kind of stuck in because they're like, what is good versus bad? So I think that's such a great intro. So let's just begin with like, what even leads to the skin problems?
Yeah, there are many factors that lead to skin problems, and I'd like to just focus on a few that we, the orthotists, tend to see in clinical settings. So, the first one being the improper fit of the boot and the bar. So, an ill fitting AFO can cause excessive pressures and frictions, leading to redness, blisters, and potentially sores, which is not, of course, what we want to see underneath the boot. So the question is the AFO too tight or is it too loose? And that is the bottom question. We don't know. That's what our job is to investigate that for you. So the lack of movement will lead to redness, as we just mentioned prior, because we need to correct the alignment of your cutie's foot. We have to prevent motion. So we're automatically going to see redness. And again, good redness versus bad redness is redness that dissipates within 30 minutes. I also love to describe that as the redness we get when we cross our legs. So if you cross your legs, you tend to get your 2 dots of redness on either side of your legs. When you uncross your legs, you see that redness. And it's not something that we stare at because as an adult, we're like, that redness is going to fade, no problem at all. But again, your cutie's foot is under a microscope. And so that is something, again, that we should see. We should see redness when we're removing the boots because we are correcting the alignment. But again, back to kind of the lack of movement, restricting the natural foot movement can lead to pressure points and skin irritations. So just being mindful that pressures are necessary again to correct your clubfoot cutie's alignment. Now, moving on to kind of things that we do see clinically is skin hygiene, and that can also contribute to problems. So following cast removal in particular, and at the onset of your first pair of boots, our first thought is to run home and just soak your cutie's foot in like the nicest little bubble bath they've ever had, just to get rid of that casting gunk and funk. But this is actually can contribute to skin breakdown. Think the Goldilocks rule, you don't want the extremes. So a clean, dry, and cool skin is the best under any orthotic device. Do not over moisturize the skin and do not increase the bathing routine that your child has set. You will be the best parent, of course, knowing how frequently your child's skin does need bathe, but do not think that since they're in the boots and bar that their foot itself needs a bath every day. So whatever's best and for your child's skin otherwise, that normal bathing routine, that should be the same thing for the foot and ankles as well. The other thing is just skin moisture. So sweat and moisture can soften the skin, kind of make it a little bit pruny, and that makes it more susceptible to having breakdown or even fungal infections, which is obviously not great underneath there too. So tips for this concern is to switch out your cutie sock halfway through the day, or at a minimum, a new clean dry sock prior to your cutie's nighttime routine so that the skin can remain dry. Really, we're recommending just a sock that is full length of the actual AFO and super thin. The way I always describe it to my parents on what type of socks to do is just something that's nice and thin. I always think little girls' dress socks. Those are like nice, thin. You don't have to get the ruffles on the top, but just nice and thin. That helps to allow the airflow to go through the sock because it is thin, and it covers the entire skin surface area that's underneath the AFO. Now, underlying conditions is kind of the last thing we see clinically that can be a little bit problematic with skin care underneath the boots and bars. So, conditions like eczema can increase your risk of skin issues. So, in this case, it's out of my scope of practice to really refer any sort of ointments or creams. So, this is really when you need to recruit your pediatrician or back to your orthopedic physician for cases outside, again, of the orthotist scope of practice. So those are kind of the main things we see clinically that contribute to skin issues.
Yeah, I think that's such a good overview of the different reasons why. I'm such a huge proponent of parents understanding the reasoning behind things, because I think we're told, oh, there could be potential skin issues, but the reasoning behind is such a good base knowledge for parents who are entering into that phase, so then they can go, okay, this is where we're trying to delineate what's normal, what could be problematic, and then let's move into things that I can do as a parent to help prevent skin issues. Because I think that's one of the common themes that you hear in these groups is parents going like, okay, what kind of socks should I use, like you mentioned, and then or should I be making adjustments to the boots, doing all of these things to help prevent skin issues. And I think anyone who knows my story knows that I wanted my cutie's boot to be the most comfortable, best protected foot of all time. And in reality, that ended up backfiring, because I ended up putting so much in there that it added bulk. So I think that's the part where parents are like, it's our best intentions, but if you know the base, that information behind it, then you can start to go, okay, this is what we're trying to identify what can do. So what are things that you actually, or if anything, that parents can do to prevent skin issues from the onset?
Yeah, so I think number one for kind of tips at home is to just follow the break-in schedule that either your orthotist is providing or your physician is providing. And that's going to help to make sure that you can keep a close eye on the skin as that skin adapts to the AFO. So as you recall, following casting method, it's important to get to a full-time wearing schedule as quickly as possible, because you're not wanting to remove that boot and bar initially because you're just told it's got to be on 23 hours of the day, but also you need to do a removal so that you can work on stretches and skin checks. And that's very, very important at the beginning. So our physician's team tends to say that anytime the child is getting up from a nap, and granted, you're starting out as an infant where you don't, or you have multiple naps throughout the day, anytime you're getting up from that nap, just taking off the boots and bar and just doing a simple skin check, whether it's 15 minutes. It's also a great way to start to desensitize the skin because it has not been susceptible to these external environments for so long since they've been in casting. So just making sure that you are removing it, but get to that break-in schedule and quickly as possible for the success of your child. The other thing from a standpoint of what you can do from home is, again, inspecting that skin for any signs of persistent redness or texture changes, such as a blister that might develop into sores. I know, Maureen, your story is like you put so much into the boot that actually that created, too much pressure, and then you ended up with that sore. So I always say to my families, when in doubt, take a photo to review with your AFO provider care team. And again, reverting back to my initial discussion, if there is restricted motion and good redness is seen following the removal of the boot, then we are achieving our goals of correcting your cutie's alignment. But if that redness starts to persist, that could indicate excess force on the foot and ankle. Or also, the counter side is that unfortunately the foot is too loose in the boot. So, Maureen, your case that ended up into a skin issue was actually that it was too tight inside. There was too much material that helped to restrict the motion, but it was too much force and pressure that then led to skin breakdown. So, a common analogy that I use is, we've all had likely a pair of shoes that wasn't the proper fit, and that led to a heel blister. So think back to that time when you had the improper shoe, it led to a heel blister. Was the shoe actually too loose or was the shoe too tight? Both can actually lead to that skin concern. Now, on the flip side, if you do believe that the boot is too tight, then potentially it's time to revisit your orthotic provider to determine if the next size is now appropriate. If you believe the boot is too loose, and your orthotist provided you initially with the tension marks on your straps, you can actually move to the next hole in the strap to then make the device just a little bit tighter. So when I'm providing a new boot to a family, I'm always marking my initial tension with a Sharpie mark, and that is the line that the actual prong of the buckle goes through. Over time, just the oils of our hands actually start to loosen the leather, and then it actually is making the leather strap longer with time. The other thing is that as your cutie's foot does correct, the forefoot actually begins to elongate. So no longer are we dealing with a super chubby foot initially. As everything starts to be manipulated and in the corrected alignment, the foot elongates, which then makes it skinnier. So just being sure that we're double checking the tightness. I always tell families, like, your memory of how tight the straps need to be, it actually comes with time. Every time you're putting on the boot and taking it off, you're feeling how tight you're putting it on. So if you need to go back a mark or go forward a mark from where my initial tension is, that's likely okay. But what you don't want is too much motion or too tight of a boot too. Now, the other thing, and I mentioned this earlier, but is actually that proper sock use. So again, Maureen says, you're always looking for the right product, what to do, but go to the basics. Always use a clean, well-fitting sock that reaches above the top of the AFO, and that will help to reduce friction. So again, my sample here is just a specific sock that doesn't have a seam in it. It's nice and thin. It also has a wicking material in it. But if this was donned on my cutie and this is my boot, it's fully above that edge of the AFO. You can always reflect this down. If it happens to be like knee-high socks, you can always reflect it over the top of the boot. And that helps you from, being damaged by the little straps there as well. The other thing is just, go back to the basics again. Keep that skin dry. So ensure the skin is dry before putting on the AFO, and consider using that moisture wicking sock. It's also recommended not to apply any lotions or moisturizers prior to putting on the boots unless otherwise advised by a member of your medical team. So soft skin tends to like to break down under orthotics, so the skin will adapt again over time with the use of the boots. But dry skin, not over moisturized, just natural oils that your baby is creating, and a nice sock, and then the boots fitting well.
Yeah, I like that. It's kind of like a Cinderella story. It's like we're looking for that Cinderella fit. It's not too big, not too small. It has a good fitting. And then you're also using the sock and the non-moisture. I think that's such a good point for parents too, is to think about, if you think I grew up kind of more outdoorsy than I am now. So my feet were really used to like walking barefoot all the time when I was a kid. Now I go outside barefoot and I'm like, ow, everything hurts, right? So I think there is that part where you're like, you think about the basic of it's going to adjust and your child's skin is going to adjust over time. So some of those issues that you face in 23-hour wear, when they're also just newborns and their skin is more pliable than it would be at 4, right? So some you're going to be adjusting as time goes on, but if you're remembering back to those basics of like a Cinderella fit, a good dry foot with a good moisture wicking clean sock, we're setting ourselves up on the right path, regardless of where your cutie is at in treatment.
Love it.
Yeah. So what about red? Well, I know we've talked about red marks, right? So we've talked about red marks versus bad red marks. Sometimes I've even had this experience of like, okay, it's lasting longer than 30 minutes.
Mm-hmm.
When do I start to go, okay, this is something that I need to contact my provider about?
Yeah. So there's two things that I always mention. So again, back to the basics, a red mark is a problem if it's persisting longer than that 30 minutes after you remove the AFO. The other thing I tell families is like, if it gives you a parental reaction and you are shocked by something, we should know.
Okay.
Even if you're getting close to that point where it's like, oh, maybe this is a bad one, maybe not. That's when you snap that photo. Ideally, you can send it into a member of your care team so that you can kind of review that and really make a decision whether or not it's something that you do need to come in for, or we can try to walk through it and talk through it in a virtual consult to really address your concerns. But again, if it's something that you take off that boot and you are shocked by it, then that is when we've kind of let it go too far. So even if you're concerned, remember that our goals are the exact same thing as your goals for your cutie. Is we want the optimized fit for the best outcomes. And so by all means, that is part of our jobs, is to make sure that we are providing the best fit of the AFO and the success of your child.
Yeah, I love that. I think that's such a good point. If you have a parental reaction to that red mark, it's probably a pretty good indicator that maybe it's something that needs to be checked up. Like I am a admittedly anxious parent, so there were times where I was like, is this more than, but but even it can never hurt to check, right? You can go, oh no, but that looks okay. And so it's always that sort of coming back to you guys are partners in this team, that your provider doesn't know what is happening at home daily. So unless you tell them, they're not going to be able to help you, and they want to help you. I've never met one Clubfoot professional that was like, nah, I don't really want to hear from parents. Every single one is like, please, if you have an issue, always send us a message. We're happy to help. So I think that's such a good takeaway, that if there is something that feels wrong, I always say, then it probably is. So do something about it and don't be afraid to ask.
Right. And it's never a bad thing when you're just reassured, when you say, it doesn't look this bad, but I'm really concerned about it. Well, great. Send it in and I can be like, that's a great redness, Maureen. Like it's in the right spot. Thank you for the photos. The timestamp's appropriate. Like it's not creating a texture change. We're good to go. And that just relieves all the stress. You have so many more things to stress about. It's okay. We are here to help you out.
Yeah, I love that. I think that's such a good point. So I think a lot of parents talk about for Clubfoot, there tends to be two different types. There's like the blister, right? And then there's a sore. So what are the difference between like a pressure sore and a blister?
First, I think we should define what a blister is and what a pressure sore is. So from healthline.com, a blister is defined as a fluid-filled bubble on the skin caused by friction, and it typically affects the upper layers of the skin. So you can go back to kind of two problems that can lead to skin issues. A blister is typically caused by friction inside of the device. So that can be that the AFO is too loose fitting, or maybe the foot is not really wanting to mold into the boot's alignment. And so there is micro movement of it that then creates that blister. Again, a fluid filled bubble on the skin, and again, on the top layer of the skin. And then also to define what a pressure sore is, a pressure sore or ulcer is a deep wound caused by prolonged pressure over a bony area. It can progress through stages, affecting deeper tissue and then potentially leading to severe complications. So again, back to causations of why we're seeing two different things. A pressure sore is likely excess force and excess hold and contact that then actually creates an actual sore of the skin. And that's going to be your texture change. Granted, a blister is also a texture change, but a pressure sore is something that's really starting to like create that redness that does not dissipate, and it is caused by just excess pressure in one area for a long period of time.
Yeah, that's such a good, I think that's such a good example of that for parents, is just actually looking up the definition, because I think a lot of us are going like, is this a blister? Is this a sore? And then thinking back to what that causation is. So if you start to see like a blister or a sore forming, what's kind of your first line of defense against that getting worse?
Yeah. So number one, it's always a shock when it does occur. Back to that parental, response, like, oh my goodness, something is absolutely wrong. But I always tell families, like, keep in mind you're doing the right thing by getting your child's foot in their boots and bars. When it's donned, it's working. So what is most important in that treatment journey is that they're in the device. So yes, it's an initial shock, but following that initial shock is removal of the boots. It's not, something that in an hour's time, we're going to lose all of the correction of the foot. But stop the use of the AFO if the skin is actually open, and then contact your cuties care team to address the issues as quickly as possible. Again, few hours, even maybe potentially a night out of the brace. Like, that's not, detrimental to your child's care, but we want to get you in as quickly as possible to resolve the issue. But we'll likely recommend protecting the skin in the meantime prior to that appointment. And that recommendation might be applying a sterile thin bandage or a dressing to the area to simply protect it, and then having the sock on top of that, and then continuing the use of the boot until that appointment in person is actually scheduled. This would be, of course, at the discretion of your healthcare team, but it is, definitely an initial shock, but there's ways to kind of treat it until you can get into the care of a professional to really make adjustments to the boot and bar and investigate what caused it and ways that we can actually prevent it from happening and occurring again.
So what are some other things that parents can do to help prevent this from even happening? So if you're thinking like, okay, we're sitting here, if parents are listening to it, they're like, okay, that seems like worst case scenario. We're jumping from some red marks to like blisters and sores. There's got to be like something in between. So I never recommend adding a bunch of stuff to the boot, obviously, from my own experience. But are there other things that parents, when they see something, they should be doing?
Yeah, so there's a couple things. Like, ideally, your orthotist or your AFO provider is the one that's managing the actual mechanics of the device. So the first suggestion is that you're scheduled regularly for checkup visits. So whether that is with your orthopedic provider or whether that's with the actual boot and bar provider, the orthotist, but monitoring the fit of the AFO is really essential to the success of your child, because we're going to make necessary adjustments along the way. Another thing that we can do during appointments with your cuties care teams is they might actually apply blister prevention products, such as the silicone tongue here. So removing the leather tongue, adding the silicone tongue, this actually is created in a way that is helping to minimize friction inside of the boot and the bar. And that will again help to relieve any sort of potential pressures or sores later on. Also, we are creative beings. Like, we will find a solution to make the device better for you. Another suggestion that I've made in the past is crisscrossing the straps. That actually, and this is again over a video consult with a family, if they're having issues with the boot being too loose and their child having too much movement, that might lead to a blister. Sometimes I'll recommend that they actually crisscross the straps so that there's a nice little X, which gives just a little bit more contact over the dorsum of the foot, and that helps to hold the heel down. So there's lots of ways to manage that, but it's really at the direction of the provider. Again, you should not feel like you're alone on an island trying to make these decisions by yourself at home. Even if it's over a weekend, like, just send it into your care team. Like, some of us do check our emails over the weekend and make sure that everyone's well and supported. But again, if you're having concerns, some ways to minimize it are just keeping a really close eye on it and making sure that you're seen by your provider team on a scheduled basis. Doesn't have to be a specific time, but a regular check-in on the AFO fit is really necessary. And then go back again to that basics. Nice dry environment, the skin is clean, and that will help to prevent any sort of skin infections if you do end up with an actual open sore.
Yeah, and I think that's such a good point for parents too, what you said about taking a break from it too, if necessary. Like, if you are in an in-between and it is, Saturday night and you're like, I have an open sore and you can't get in to see your provider, like, it's not going to make or break your child's overall treatment. It's really important that long term your child is able to wear the boots and bar. So if we need to make minor adjustments to ensure that that is successful long term, then it's okay to do that. Honestly, it's in the best interest to make that happen. And I think sometimes parents need reassurance about that, because it's kind of really drilled into us that we need to be diligent and adhere to the schedule, right? But sometimes we have to be able to flex based on what's happening with our child during that moment.
Agreed. Yeah, it's a marathon, not a race, as that saying goes. And I always tell families, if it's a day or even 2 days out of the device, that in the long run is nothing when you spend weeks or months out of the device. So again, staying diligent, being eyes and advocating for your child's skin, like that's all you have to do, and getting a minute is good. But if we need to take a break, we take a break, and that's a-okay.
Yeah. So let's talk a little bit about athlete's foot. I feel like I hear about this all the time. I remember my personal experience. I was like, what is this? And because it just seemed for us like dry skin on her toes. And I was like, what is? And then they were like, oh, it's athlete's foot. And I was like, what? Like, I had never had experience with athlete's foot prior to this. So I didn't even know what an indicator was for it. So just tell us a little bit about like what it is and what we should be looking for.
Yeah, so in accordance to Mayo Clinic, athlete's foot is a fungal infection that infects the skin on the feet, causing itching, redness, and peeling. So back to kind of your signs and symptoms, it's hard to differentiate when your like potential infant is itching, but like obviously your 3-year-old's gonna really tell you like, that's itches, mommy, I need some help. But the redness and peeling are the great indicator, and really like on the top side of the toes in particular is usually where I've seen it clinically. But those are some major like red flags. And again, from a standpoint of an orthotist, is that unfortunately that's kind of out of our scope to actually diagnose. But those are kind of your red flags that indicate that there might be an actual fungal infection going on. So ways to handle it are just keeping that foot dry. Wash and dry the feet thoroughly, especially between the toes. So I know for me, even our infants, towels that we're drying them off with, they might be really thick towels. So grabbing maybe just a clean, dry washcloth and just really getting in between their toes as you're drying them off. And especially on the underneath sides of the toe, that's also an area that's prone to just like trapping in some extra moisture, which then can lead to that infection. Also, at the very beginning, if you can go back to when your cutie's feet are coming right out of their cast, you sometimes get that invagination in the skin, especially where the ankle is starting to curve in. Ideally, some of that's corrected with your casting alignment, but that area in particular can be a real prone spot to just trapping and harboring a lot of things that can lead to infection. So nice, clean, dry feet, washed on, again, your regular basis that you prefer for your child. Again, out of my scope, but, if you were to go see your provider, your physician, applying over-the-counter antifungal creams or powders. And then lastly is always a just reminder that the boots can be cleaned and they need to be cleaned. And they can be cleaned. And that's an easy set of instructions that I provide for families. But the easiest way is just using mild soap and water, rinse and dry. Or you can use rubbing alcohol in a clean cloth and wiping down the insides and the inner parts of the leather straps with rubbing alcohol if you're needing to do a quick cleaning situation. Now, as your child is wearing the boots and bars at 23 hours out of the day, I would not suggest actually washing the device with the mild soap and water, only because that's a long period of time for it to dry. So my recommendation in 23-hour wear schedule is just the rubbing alcohol, keeping it clean by disinfecting it. But as your child gets older, they tend to get their little odors and they start to have a little bit of a funk in the boot. You're wearing them for longer periods of time from a standpoint of like the longevity of the boot itself. And so at that point, it starts to harbor some odor and you're like, wow, this smells like a dirty gym sock and I don't love that. So at that point, I'm recommending anytime that you're actually laundering your child's bed sheets, regular basis, not if they have an accident, but laundering them on a regular basis, that's when you should also wash your boots at the same time. So again, mild soap and water, scrubbing them down, doing that in the morning and letting them air dry throughout the day. They're going to be ready to go by the time that you're needing to get them on before bedtime.
Yeah, I think those are all such good points I didn't even think about that, but yeah, I would recommend that now of like having your I'm thinking back to when we washed our cutie, right? And like even now, it's like the toes, I'm not giving a lot of attention to dry her toes. You just assume when you get out of the shower or whatever, like your feet are going to dry. Like you're not but that is true. And especially when they're not mobile yet. So they're not moving all around a lot. Their toes, they can definitely just trap that little, especially if you're doing bath time right before bedtime. And if you've moved into that nighttime wear, it might just be like, okay, and just remember this in the back of your head and go, okay, maybe I need to just give an extra second to really make sure that I'm getting dry in between those little crevices that all the little cuties have.
Yeah. And I also would describe it, I mentioned earlier about peeling. It can also be cracking the skin. So that's why I mentioned that area just right as the toes, curve. Like that area in particular, as a person that struggled with athlete's foot before, that is an area where I am prone to having cracking. And so that is an area, keep it nice and dry. And that way you can actually just, harbor a nice, safe environment for your child.
Yeah, I think that was our experience is that it was the cracking. Mm-hmm. So it wasn't necessarily peeling. So then we were like, what are these like cracks? And then you're trying to, and honestly, for us, it wasn't even that she was really bothered by it. It was more something that we had seen and we're like, okay, how are we counteracting this? And I think it's also during your child's skin is different during different seasons of the year. And so being on alert for making those adjustments because during the summer, we didn't seem to have as much of that because her feet were open a lot during the day, right? That she's like running around barefoot. During the winter, we had more struggles with it because she wasn't even in her boots and bar. She was still in a sock and a shoe, right? She's in warm boots. She's in things that are keeping her feet more with that moisture, sweat lock in there. Whereas during the summer, it was a more airy environment.
Yeah. Yes. Absolutely.
So just taking those things into mind as a parent too, of just going, okay, so it's not always going to be the same, just like our feet aren't always the same throughout the year.
Correct.
What about ingrown toenails? This is another thing that people talk of. It's skin. I don't know if it's skin specific, but it's definitely skin adjacent. And it's one of the things that we haven't had experience with, but a lot of people have experience with clubfoot. So what is it and what are we looking for?
Yeah, so Mayo Clinic states that an ingrown toenail occurs when the edge of the toenail grows into the surrounding skin, causing pain, redness, and swelling. Now, this is actually not an uncommon occurrence for many infants. I mean, I can go back to when my son's toenails were like, growing and they were just like crazy and gnarly. They're just like they're funky.
Yeah.
He actually struggles with ingrown toenails and he's not a clubfoot cutie. So again, it's not that it's an uncommon occurrence for a clubfoot cutie, but also like not uncommon for, someone without clubfoot to have. So, but it's typically on the big toe in particular. And what your kind of red flags would be is if you start to see almost like a little bubble on the outside of the big toe or even inside of the big toe, and it's starting to look red, like it's festering something. And then sometimes if it does get to the point where it is truly an ingrown toenail, at that point, you can also see some of that pus come out of it if it does end up breaking that skin. So it can be a little nasty and an ugly, like little toe, but not uncommon even outside of the clubfoot world. So first line of defense is just proper nail trimming. And it's kind of like that baby hair that comes in and you're like, oh, that one's been there since they were born. And I think I need to trim it just so that it like evens out. Same thing with their toenails. Like it is a wild process for toenails to come in, but making sure that you're trimming those toenails just straight across, avoid cutting them too short as well. The other thing that can potentially lead to ingrown toenails is if your sock is really, really tight up against the toes, that can also prevent the toenail from actually growing. So when you're putting on the sock, if you're struggling with ingrown toenails, just give it a nice little tug so that there is just a little extra material at the end of the sock to just allow for that normal growth. So monitoring for early signs is checking just the toe at each time that you're bathing them and just making sure that we're trimming the toenails as soon as you can, not letting them get too long or too short. Too short is really the reason why that sometimes you get the ingrown toenail. If you feel as if the boot is actually causing the issue and it is not resolved with proper trimming of the toenail, just be sure to schedule an appointment at that point with your care team, and we can just assess the fit of the boot. In most cases, it's not necessarily the boot potentially causing that, and it is just something that you mentioned is just adjacent to potential skin anatomy or genetics, all the fun things. So this might end up falling out of the scope of the orthotist or your AFO provider's scope of practice. So your cutie's orthopedic physician, whether it's your pediatrician or a referral out to a pediatric podiatrist, those might be some avenues for support in these cases.
Yeah, I think that's such a good point about, I think it's so hard to decipher, but it is good to keep in mind that it's not just a clubfoot related thing. That's one of the things we talk about in clubfoot in general treatment. What is baby stuff? And then what is related to the boots and bar? Because I think we can get into our heads of like everything is related back to that. But it's like ingrown toenails are common. Skin issues are common. Like a lot of babies have a lot of different things. And yes, we have to take extra precautions. And other avenues when it comes to skin, but I do think it's important for you to just remember that like all babies have different sort of varying levels of issues when it comes to skin, toes, that sort of thing. One of the things that I found for us was hard. I mean, you get these like little baby toenails and you're like, first of all, my kids, I like if you followed our story too, our cuties toenails were wild for a long time. Like it's even now, she's been out of boots for probably a year and a half now, and they're finally starting to kind of normalize and look normal. And I'm like, but a lot of the times they're like kind of curved up. They do kind of have a little bit of a different vibe than other babies' toenails. And so we found that if I couldn't clip them, I would use there's like these S file nail files, and I would use that to kind of just maintain the shape of it without having to feel like, am I going to clip it like too short? It's like when you have your pet, and if you've ever tried, which I never do, but like try to trim their nails and you're like, oh, like, is it going to bleed? Am I going to do it too short? Like, so the nail file just gave me a little bit more of like, okay, I can do these in smaller increments without feeling like I'm going to do too much damage, right? That's the balance for parents too, is being like, I want to make sure that I'm doing the right thing, but not overdoing it. So how are we finding that balance?
That's a great tip. I didn't even think about that. I'm going to put that back here and have that for my clinical practice too. That's great.
It's crazy. It's crazy the amount of little things they make for like little babies that you don't like. But sometimes you have to search. You don't know about it until you search for it. And you're like, oh, that was actually very helpful versus other avenues. So yeah, that was one of the things that we use to kind of maintain her wonky toenails, they are better, guys. So just if you're having concern about the toenails, it does get better. Okay. They will start to even out. Yeah.
You're 3 years old and my son does not have clubfoot and he's still got wonky toenails. So
yeah.
Yeah, they are cross that branch someplace sometime.
I feel like they're just growing at such a rapid rate at that age, and their toenails are new, so they're like trying to just rest assured it will even out over time. Yeah. So, is there a triage tree that handles like different skincare issues? Because we talk a lot about the different people on your medical team, right? And there are a lot of people involved in your baby's life, especially if you have other care providers outside of your pediatrician. So, do you kind of have a triage of who should address what issues?
Absolutely. So definitely different healthcare providers provide various skincare issues and help to resolve those. So your orthotist or your AFO provider is someone that adjusts and modifies the fit of the boot and the bar and addresses kind of the mechanical issues. So, such as that boot being too loose or too tight or being outgrown, our job is to really optimize the fit and the connection. We call that purchase of the AFO onto your cutie's foot and ankle to optimize the outcomes. And we are all, again, trying to achieve the same goal, which is the correction of that clubfoot deformity. And your orthopedic surgeon and the actual physician providing the care, they're the ones that are really the overseers of everything. And so really, if I know that I'm drawing the line and coming close to something outside of my scope of practice, such as athletes, but I'm going to go right back to that referring physician and say, hey, like they need a little extra help here. If for some reason we're not getting a lot of feedback from that referring physician, that's when you can kind of recruit the external people, whether that's your primary care or your pediatrician, and then they can really help to work out a referral to pediatric dermatology or podiatrist if there's something such as athlete's foot or severe eczema or those ingrown toenails that have gotten to the point where even a pediatrician couldn't really handle it. So really there's a lot of triage that does happen, but in most cases, your AFO provider is likely the person you can get a hold of the quickest and the easiest, and an easy way to communicate back to. And then we can always make that decision if we do feel like it's something that's going to be outside of our scope.
Awesome. Yeah. I think that that's such a good delineation of who goes where and when. It's like the first stop is the person that fits the boot, and then they can help you determine what the next person should be if it is outside of their scope.
Mhm.
Well, thank you so much for being here today, Shannon. I feel like I learned so much that I wish I would have known. I feel like I know a lot, and I still feel like I learn something every time when we do these, because there are just little different tips that everybody uses. And when you're able to kind of take those in and go, oh, okay, like, yeah, I should try that or this, it's just so helpful. So I really appreciate you coming on today and just talking with us through all of the different skin related things to clubfoot treatment.
Yeah, well, thank you very much. And I really appreciate this opportunity to share the education that I share with families on a daily basis.
Yeah, we really appreciate it. Thank you, Shannon.
Thank you.